So welcome on stage Dr. Quy Vo-Reinhard, who will talk about transparency and security thanks to blockchain. Doctor, the stage is yours.
Good morning, ladies and gentlemen, and for those who decide undefined. My name is Quy Vo-Reinhard. I'm the co-founder and CEO of dHealth, a blockchain-based marketplace and service for healthcare sector. I did not have the answer. It's the question, can really blockchain those help to rebuild the trust in healthcare sector? And as we are working in the field, so I will just scan this really fast, not like we have to have one step back before giving the solution to anything that, okay, blockchain is cool, market is, crypto is rising, and then we find the problem. No, we have to see what kind of problems healthcare sectors are facing these days so that blockchain can really help. We have really a lot of problems. The first one is data security and privacy that we all know. The interoperability, sharing data between different sectors, different stakeholders. Also the fight drugs and supply chains integrity. And next is in the medical insurance system with efficient medical billing and claim processing. And last but not least, it was mentioned previously, does patient need more apps? Do doctors and nurses need more apps? No, so many applications these days, they just build, but not really patient-centric solution. So we need to do is more. That's the sectors that we are facing. And yeah, in fact, it is shocking to know, but maybe not shocking. Healthcare sectors with privacy and security are at risk is contribute to 26% of all kind of attacking these days. So every 1/4 of the attacking happen in healthcare and life science sectors. That is really sad because our data is at risk and we have no way to really control this. Then what can we do? Because today we have to trust a lot of organizations. We see a lot of scandals and news about the hackers in Singapore, in Australia, even with 23andMe, one of the most rising unicorn in the US, and just almost dropped to zero these days. Also in Switzerland, it's also happened. So what can we do? We really hope. And by the way, if you have any mobile apps these days, not only we trust organizations to hold and store and have our data and share this, but also when you download any apps in your mobile phone, do you really read through the terms and conditions? Check. So here I just browse one of the most used app in the well-being for running or something, and then it's the first number one. And when I check what kind of data is you consent, so it's not we trust organization, you really have no way to just like give and donate your data for free and you granted the access to your phone, to your everything by the mobile app. So we really see the problem with the data sharing and the data access these days. And then we really hope in the futures tomorrow already happened by today, that we can already in control of our data, at least in control of the access to our data when we can, and can withdraw the access when we really want to. So the question is, can blockchain rebuild the trust in healthcare? My answer is yes, but how? First of all, for the data security and privacy, we can have the decentralized network. We can grant the access. I can have some example later in the interoperabilities and grant the access. So we have so many techniques. Then you can grant the access to the folder, to one piece of data or for real-world evidence that you can stay anonymous in your data sharing. And of course, with the movement of Web3 these days, a lot of data sharing, a lot of apps, or even no apps can be used for the patient-centric and also empowerment with together blockchain and cryptocurrency or the tokenization, so we can empower people to do some healthy activities. For example, one of the use cases we do with Roche in Ukraine for the rare disease patient. So for rare disease patient, every piece of information is really valuable, and to incentivize them to share to the doctors, to the patient advocacy group. We work with the hemophilia and SMA patient, and then the patient can share directly to the doctors. Every time they share, they can get tokens in reward, and in the end of the journey, they can redeem it. So depend on the country where we do the pilot, where the tokens is legalized or not. In Ukraine, they convert it into the Uber, the voucher for Uber trip. And so means your behaviors, your data can be redeemed in different medical or non-medical services, which is valuable for a certain patient. Another use case, as I say, so you see is the demo live. So these days, with the Web3 wave, we really do not have to create a new app, so everything is Web3 within, I would say, less than a week or a day, that you can do the research with the Web3 base. And you can see here on the top is the word repeating, so the patient remain anonymous. They only just sign e-consent, e-contract, and then they share the data to the doctors. So if you have any research hereby, we demo on RedCap is one of the largest research tool for clinical trials and others in the sectors. Welcome to join us. And also with the drugs and supply chain transparency, we have also at dHealth a pilot with Swiss TBS and University of Basel. So the problem with the vaccine donation from Switzerland to some of the country here in Africa that gets sold to the rich people, but not, it's donation, so it should be free for everyone, but in the end it's got sold to the rich people there. To help for the more transparent process, we do the supply chain tracking and management here. So with the log files, and it can be monitored on blockchain. So we know that the medicine, the vaccine, the rabies vaccine, get donated and get the last people who have this injection can really log it in the file, and we know this process happen in a fast, fair, and transparent manner. But yeah, it sounds really promising. But why? Why is not going to the really mass adoption? Bitcoin in the last week is rise into 100K US dollar, but still the application of blockchain in healthcare sector is not like that's promising. As we see, we have to face with a lot of problems. Like the first part, as we know, that is the regulatory compliance. Those it help with for the companies and enterprise and entities to comply with GDPR and others for the data privacy, but there are many others to consider. The second part is the scalability and performance. That also Canton of Vaud and Canton of Zurich have different areas, and then we have different infrastructures, so it's really difficult. Of course, data privacy and security, still it helps to resolve this problem, but it doesn't mean it face, there are many cases that application put the data on chains, means you cannot really ever delete it, so there's the big question here. And also many applications. For me personally, for Web3 application, it's really easy. You don't have to download the app. You just have the browser, and then you can work on this. But it's not for everyone. Many people, and especially patients, we have many groups which is not very tech savvy. So we have to really design and develop the application would be useful and easy to use for everyone. And finally, ethical consideration, because blockchain is mostly together with the cryptocurrency, so there is the unethical part, I would say, for the people who more or less get rich by this, and then there is the inflation, and there's many other things. But to get blockchains to the mass adoptions and also together can really help patients. I would say collaboration is key. If you want to go fast, go alone. If you want to go far, go together. So yeah, thank you so much.
So maybe we will have some question for you.
Yes.
So, let's see. So in the meantime, I will have a question. Okay, we see that blockchain has made some progress, especially in the bank system, right? So we know that. Yet it didn't seem to boom in the health sector. Do you have, what is specific about the health sector that would prevent this? Do you have some clue about this?
Yeah, I can say in general speaking, because blockchain is still really new. It's not so new, but in terms of application in healthcare sector, it's still really young. So in the end of the day, innovation contribute and technology contribute around like 20% of the whole process to go to the people. So 80% of the day is the people who really implement it, who really execute it. And from my personal experience, so it's cool, it's help patient, but also just do they really need it? Because like patients, they have to face with many other problems. Many patients really do not really care about privacy. Also, on the other side, that in terms of innovation as a whole, like doctors and nurses, they really spend like 10 minutes more per day to learn about new cool technology on top of their exhausting life. And they have like some resistance to really apply. But I really hope that when the patient really need it, so they lead the way to go, that everyone will do something for the patient. Yeah.
Right. Thank you very much.
Yeah, thank you.